Medical Assistant Exam Specimen Collection Questions. Question 1. The care team in a patient education session asks for guidance because a patient asks for a copy of their medical record. Which action should the assistant take? Option A. Refuse because records belong only to the provider. Option B. Give the record to anyone who asks. Option C. Follow the office release of information process. Option D. Delete sensitive information before the request is reviewed. The correct answer is option C. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Patients have rights to access their health information under applicable rules. Identity and authorization must be verified before disclosure. Altering the record is inappropriate and may violate legal requirements. Question 2. A medical assistant is working in a diagnostic testing area when the term cardiology appears in a referral. Which specialty is involved? Option A. Kidney disorders. Option B. Digestive disorders. Option C. Heart and cardiovascular system. Option D. Skin disorders. The correct answer is option C. Heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Nephrology focuses on the kidneys. Gastroenterology focuses on the digestive system. Dermatology focuses on the skin. Question 3. While working in a quality control review, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A. Disinfection always destroys every spore. Option B. Packaging instruments makes cleaning unnecessary. Option C. Sterilization is the same as hand washing. Option D. Organic material can interfere with sterilization. The correct answer is option D. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Disinfection reduces many organisms but does not reliably destroy all spores. Packaging dirty instruments traps contamination rather than preparing them safely. Hand washing reduces microbes on skin but is not instrument sterilization. Question 4. Following office protocol in a treatment room, a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A. Report results before the test develops. Option B. Skip controls because waived means unregulated. Option C. Follow manufacturer instructions and quality control policy. Option D. Use expired kits if the package is unopened. The correct answer is option C. Follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Reading before the correct time can produce inaccurate results. Waived status does not eliminate quality responsibilities. Expired test kits may give unreliable results. Question 5. While working in a primary care office, a rapid strep test requires a throat swab. Which technique is best? Option A. Swab the outside of the lips. Option B. Touch the tongue repeatedly to collect saliva. Option C. Swab the tonsillar area and posterior pharynx while avoiding the tongue. Option D. Collect sputum from a deep cough. The correct answer is option C. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. The lips do not provide the specimen needed for strep testing. Saliva and tongue contact can dilute or contaminate the specimen. Sputum is not the specimen used for a rapid strep throat swab. Question 6. Given the workflow in a preventive care visit, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A. Take the temperature immediately because oral readings are unaffected. Option B. Wait according to office protocol before measuring the oral temperature. Option C. Record the temperature as normal without measuring it. Option D. Switch to a rectal temperature without asking. The correct answer is option B. Wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Recent liquids can affect oral temperature results. Vital signs must be measured rather than assumed. Changing to an invasive route requires proper indication and protocol. Question 7. To protect safety in a certification exam scenario, A provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, prone position. Option B, lithotomy position. Option C, Fowler position. Option D, Trendelenburg is the only routine choice. The correct answer is option C, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Prone places the patient face down and may worsen breathing comfort. Lithotomy is used for pelvic procedures and does not primarily support breathing. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Question 8. To protect safety in a cardiology practice, a patient becomes angry about a long wait time. Which response is most appropriate? Option A, blame the provider in front of the patient. Option B, tell the patient to calm down or leave. Option C, acknowledge the frustration and provide a realistic update. Option D, ignore the patient until the appointment starts. The correct answer is option C, acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Blaming coworkers is unprofessional and does not solve the issue. Commands can escalate conflict and harm patient rapport. Ignoring frustration often makes the situation worse. Question 9. Following office protocol in an outpatient laboratory, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A, wet the electrodes with tap water only. Option B, ignore loose electrodes if the tracing prints. Option C, prepare the skin according to protocol to improve electrode contact. Option D, place electrodes over clothing. The correct answer is option C, prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Unapproved moisture does not replace proper skin preparation. Loose electrodes can create artifact and poor quality results. Electrodes must contact skin to record electrical activity. Question 10. While working in a patient education session, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A, leave the tube unmixed until pickup. Option B, shake the tube forcefully. Option C, open the tube and stir with a swab. Option D, gently invert the tube the required number of times. The correct answer is option D, gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staph. Question 11. Before the visit continues in a medical office workflow, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A, verify the allergy information and enter it clearly in the medical record. Option B, place the form in the chart without reviewing it. Option C, ask the patient to remember only prescription allergies. Option D, remove allergies that the patient says happened many years ago. The correct answer is option A, verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Important safety information can be missed if the history is not reviewed. Allergies to over-the-counter drugs, foods, or latex may also affect care. Past reactions may still be clinically important and should not be deleted without provider direction. Question 12. When a patient encounter unfolds in a medical office workflow, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A, tell the patient dizziness is impossible. Option B, assist the patient to sit or lie down safely. Option C, ask the patient to walk faster. Option D, leave the patient standing while searching for forms. The correct answer is option B, assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. An unsteady patient should not be left unsupported. Question 13. To protect safety in a quality control review, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, keep only the first void and discard the rest. Option B, collect urine only when symptoms occur. Option C, discard the first void and collect all urine for the next 24 hours. Option D, leave the container unrefrigerated unless it smells unusual. The correct answer is option C. Discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. A single first void is not a 24-hour collection. Timed urine testing requires all urine during the collection period. Storage requirements should follow the test protocol and preservative instructions. Question 14. Before the visit continues in a certification exam scenario, a chain of custody urine drug screen is collected. Which practice is most important? Option A, use an unlabeled container until the lab receives it. Option B, document each transfer and maintain specimen integrity. Option C, skip signatures if the specimen looks normal. Option D, allow the patient to take the specimen home first. The correct answer is option B. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Unlabeled specimens can be rejected and cannot be reliably traced. Appearance does not replace custody documentation. Uncontrolled possession breaks specimen integrity. Question 15. After reviewing the situation in a telephone triage workflow, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, wait until a patient reports slipping. Option B, ignore it because it is not in an exam room. Option C, cover it with loose papers. Option D, place a warning sign and arrange cleanup immediately. The correct answer is option D. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Prevention should occur before an injury happens. Safety hazards matter throughout the facility. Loose paper can worsen slipping and does not clean the hazard. Question 16. At the start of care in a treatment room, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, leave the old pharmacy because it is already in the chart. Option B, update the preferred pharmacy after verifying the new information. Option C, choose the pharmacy closest to the clinic. Option D, delete all pharmacy information from the record. The correct answer is option B. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. The preferred pharmacy should come from the patient rather than staff convenience. Removing needed information can interrupt prescribing workflows. Question 17. Before the visit continues in a community health clinic, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A, skip precautions if the patient is already taking medication. Option B, use only sterile gloves without a mask. Option C, place the patient beside an immunocompromised patient. Option D, apply droplet precautions and offer a mask according to protocol. The correct answer is option D. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Treatment does not remove the need for appropriate precautions. Sterile gloves do not protect mucous membranes from respiratory droplets. Separating symptomatic patients helps reduce transmission risk. Question 18. In a same-day appointment, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PASS. Option B, ARICE. Option C, HIPAA. Option D, PERLA. The correct answer is option A, PASS. PASS stands for pull, aim, squeeze, and sweep. RICE refers to rest, ice, compression, and elevation for certain injuries. HIPAA governs health information privacy and security. PERLA describes pupil assessment. Question 19. When a patient encounter unfolds in a quality control review, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, notify the provider or designated clinical staff promptly. Option B, file the result for review at the end of the month. Option C, discard the result because it is abnormal. Option D, tell the patient the exact diagnosis without provider review. The correct answer is option A, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Delaying a critical result can put the patient at risk. Abnormal results must be reported, not discarded. Diagnosis and interpretation belong to the provider. Question 20. A medical assistant is working in a women's health clinic when blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Label the empty tube as collected. Option B. Gently adjust the needle position while maintaining safety. Option C. Remove the tourniquet and continue filling all tubes. Option D. Probe aggressively until blood returns. The correct answer is option B. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. A tube without the required specimen must not be labeled as completed. Without blood flow, the collection cannot continue effectively. Excessive probing can injure tissue and increase patient discomfort. Question 21. In an electronic health record review, a patient asks which body system includes the skin. Which system should be identified? Option A. Respiratory system. Option B. Integumentary system. Option C. Urinary system. Option D. Endocrine system. The correct answer is option B. Integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The respiratory system supports breathing and gas exchange. The urinary system filters blood and eliminates urine. The endocrine system is made of hormone-producing glands. Question 22. To protect safety in a medication administration visit, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It communicates the patient's wishes about future medical care. Option B. It replaces all insurance forms. Option C. It allows the assistant to ignore provider orders. Option D. It is used only to schedule appointments. The correct answer is option A. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Advance directives do not replace billing or insurance documents. Care decisions still follow legal, clinical, and facility processes. Scheduling is unrelated to the purpose of an advance directive. Question 23. Following office protocol in a phlebotomy station, a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the room number. Option B. Only the patient's favorite color. Option C. Only the assistant's initials with no service information. Option D. Procedure code and diagnosis or reason for the service. The correct answer is option D. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Room numbers do not describe the service or diagnosis. Personal preferences do not support claim coding. Initials alone do not provide billing codes or medical necessity. Question 24. While working in a procedure setup, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A. Count for 5 seconds and multiply by 12. Option B. Record the respiratory rate from the last visit. Option C. Ask the patient to breathe as deeply as possible. Option D. Count respirations while the patient is unaware of the measurement. The correct answer is option D. Count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Very short counts are often inaccurate for respirations. Current respirations must be measured during the encounter. Deep breathing changes the normal respiratory rate and effort. Question 25. In a busy front office, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Use latex-free supplies and clearly communicate the allergy. Option B. Tell the patient to bring personal gloves only. Option C. Ignore the allergy if the procedure is short. Option D. Use powdered latex gloves because they are easier to put on. The correct answer is option A. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. The clinic remains responsible for preparing a safe care environment. Even brief latex exposure can cause a serious reaction. Latex gloves can trigger a reaction in a latex allergic patient. Question 26. During a walk-in clinic, An adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A, abandonment. Option B, respondeat superior. Option C, patient autonomy. Option D, beneficence. The correct answer is option C, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Respondeat superior concerns employer responsibility for employee actions. Beneficence means acting for the patient's good but does not override a competent refusal. Question 27. Before the visit continues in a community health clinic, a provider orders a capillary blood glucose test. Which site preparation is important? Option A, use the first visibly dirty drop for every test. Option B, skip patient identification because the test is quick. Option C, clean and dry the puncture site according to protocol. Option D, puncture through visible dirt. The correct answer is option C, clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Site contaminants can affect the first drop depending on protocol. Patient identification is required even for quick point-of-care tests. Contamination can affect the sample and infection risk. Question 28. To protect safety in a walk-in clinic, a patient needs crutch walking education after provider instruction. Which principle is important? Option A, crutches should be used only on wet floors. Option B, the patient should skip follow-up if pain increases. Option C, crutches should fit properly and not press into the axilla. Option D, body weight should rest mainly on the armpits. The correct answer is option C, crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Crutches are mobility aids and wet floors increase fall risk. Worsening symptoms should be reported according to instructions. Weight should be supported through the hands, not the axilla. Question 29. The care team in an exam room asks for guidance because an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A, use the defibrillator on a conscious patient asking questions. Option B, wait for the provider before starting any response. Option C, begin CPR and use the automated external defibrillator as directed. Option D, give oral medication before checking responsiveness. The correct answer is option C, begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Delaying basic life support can reduce survival. Oral medication is unsafe when cardiac arrest is suspected. Question 30. As part of exam preparation in a same-day appointment, a patient asks why a medication is placed under the tongue. Which route is being described? Option A, ophthalmic. Option B, sublingual. Option C, gotic. Option D, topical. The correct answer is option B, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Ophthalmic medications are used in the eye. Otic medications are placed in the ear. Topical medications are applied to the skin or surface tissues. Question 31. While working in a procedure setup, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A, clarify the order before proceeding. Option B, ignore the medication order completely without communication. Option C, interpret the abbreviation however it seems most likely. Option D, ask another patient what the abbreviation means. The correct answer is option A, clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Guessing can lead to serious medication errors. Patients are not appropriate sources for interpreting orders. Question 32. An office review in a family practice clinic shows that lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, midway between V2 and V4. Option B, fourth intercostal space at the left sternal border. Option C, fifth intercostal space at the left midclavicular line. Option D, a fourth intercostal space at the right sternal border. The correct answer is option C, fifth intercostal space at the left midclavicular line. V4 is placed at the fifth intercostal space along the left midclavicular line. That location is used for V3 rather than V4. That location is used for V2. That location is used for V1. Question 33. As part of exam preparation in a diagnostic testing area, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A, urinary bladder. Option B, gallbladder. Option C, thyroid gland. Option D, appendix. The correct answer is option C, thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The urinary bladder stores urine and does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The appendix does not produce thyroid hormone. Question 34. A medical assistant is working in a phlebotomy station when a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, remittance address. Option B, copayment. Option C, coinsurance. Option D, referral. The correct answer is option C, coinsurance. Coinsurance is the patient's percentage share of covered costs. A remittance address tells where payments or documents are sent. A copayment is usually a fixed amount rather than a percentage. A referral is permission or direction to see another provider. Question 35. To protect safety in a quality control review, a peak flow test is ordered. Which body system is being assessed? Option A, integumentary system. Option B, urinary system. Option C, respiratory system. Option D, skeletal system only. The correct answer is option C, respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The integumentary system involves the skin, hair, and nails. The urinary system is assessed with urine tests and related procedures. Peak flow does not measure bone structure. Question 36. In an electronic health record review, a specimen must be protected from light after collection. Which handling method is appropriate? Option A, place the tube in direct sunlight to warm it. Option B, leave the specimen uncovered at the front desk. Option C, wrap the specimen in foil or use an amber container as directed. Option D, shake the specimen vigorously for 1 minute. The correct answer is option C, wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Sunlight can degrade light-sensitive specimens. Delayed or improper handling can compromise results. Vigorous shaking can hemolyze blood specimens. Question 37. At the start of care in an administrative check-in area, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, light blue tube. Option B, gray tube. Option C, lavender tube. Option D, green tube. The correct answer is option D, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Light blue citrate is used for coagulation testing. Gray tubes are often used for glucose-related testing depending on protocol. Lavender EDTA is typically used for hematology testing. Question 38. The care team in a specialty referral visit asks for guidance because a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The test records electrical activity and does not deliver a shock. Option B. The machine draws blood through the wires. Option C. The test shocks every patient to start the heart. Option D. The electrodes inject medication. The correct answer is option A. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrocardiogram leads do not collect blood. A standard electrocardiogram does not deliver electrical therapy. Electrodes record signals and do not inject medication. Question 39. After reviewing the situation in an administrative check-in area, a claim requires the code that explains why a service was performed. Which code set is used? Option A, ICD-10-CM. Option B, place of service only. Option C, CPT. Option D, NDC only. The correct answer is option A, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. Place of service identifies setting, not the medical reason for care. CPT codes report procedures and services rather than diagnoses. National drug codes identify medications and do not describe diagnoses. Question 40. During a walk-in clinic, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, quality control testing. Option B, breach of confidentiality. Option C, appropriate marketing. Option D, routine scheduling. The correct answer is option B, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Quality control relates to test system accuracy, not social media disclosure. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Scheduling does not involve posting private health information publicly. Question 41. Before the visit continues in a quality control review, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A, sinoatrial node. Option B, ureter. Option C, gallbladder. Option D, alveolus. The correct answer is option A, sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. A ureter carries urine from kidney to bladder. The gallbladder stores bile and is not cardiac conduction tissue. An alveolus is a lung air sac. Question 42. To protect safety in an exam room, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, venipuncture. Option B, auscultation. Option C, prior authorization or referral process. Option D, autoclaving. The correct answer is option C, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Venipuncture is blood collection and does not authorize insurance coverage. Auscultation is listening to body sounds and does not approve visits. Autoclaving sterilizes instruments and is unrelated to payer approval. Question 43. During a patient education session, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A, discuss the patient's body in the hallway. Option B, skip explanations because the patient signed in. Option C, provide appropriate draping and expose only the area being examined. Option D, leave the patient uncovered until the provider arrives. The correct answer is option C, provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Public discussion can violate privacy and professionalism. Patients still need respectful communication during preparation. Unnecessary exposure reduces dignity and comfort. Question 44. A medical assistant is working in a preventive care visit when multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A, lavender EDTA tube. Option B, green heparin tube. Option C, gray fluoride oxalate tube. Option D, light blue sodium citrate tube. The correct answer is option D, light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. EDTA tubes are collected later because the additive can contaminate other tubes. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. Gray tubes are generally collected near the end of the order. Question 45. As part of exam preparation in an outpatient laboratory, a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, move it over the venipuncture site. Option B, release it and allow the arm to recover before continuing. Option C, tighten it further until the vein bulges. Option D, ignore the time because tourniquets do not affect tests. The correct answer is option B, release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. A tourniquet is placed above the site, not over the puncture area. More pressure can increase discomfort and alter specimen quality. Tourniquet time can affect certain laboratory values. Question 46. When a patient encounter unfolds in a procedure setup, a waived glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A, record patient results without documenting controls. Option B, use the meter because patient samples are different. Option C, change the patient's diagnosis to match the meter. Option D, resolve the quality control problem according to protocol. The correct answer is option D, resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Quality control documentation is part of reliable testing. Failed controls must be addressed before reporting patient values. Medical assistants do not diagnose and should not alter clinical information to fit a device. Question 47. Following office protocol in a medical office workflow, a specimen label is missing after collection. Which action is best? Option A. Ask another patient if the tube belongs to them. Option B. Follow facility policy for recollection or correction without guessing. Option C. Send the tube with no label and explain later. Option D. Write a name on the tube from memory. The correct answer is option B. Follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Patients cannot resolve specimen identity errors reliably. Laboratories commonly reject unlabeled specimens. Guessing can cause a serious misidentification error. Question 48. Following office protocol in a same-day appointment, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, supine. Option B, Sims. Option C, Fowler. Option D, prone. The correct answer is option A, supine. Supine means lying on the back facing upward. Sims position is side-lying with one knee flexed. Fowler position is seated or semi-seated. Prone means lying face down. Question 49. An office review in a busy front office shows that a glucose test requiring glycolysis inhibition is ordered. Which tube is commonly associated with this additive purpose? Option A, blood culture bottle. Option B, lavender tube. Option C, light blue tube. Option D, gray tube. The correct answer is option D, gray tube. Gray tubes commonly contain additives such as fluoride that help inhibit glycolysis for glucose testing. Blood culture bottles are used to detect bloodstream microorganisms. Lavender EDTA is used mainly for hematology testing. Light blue citrate is used for coagulation studies. Question 50. Before the visit continues in a telephone triage workflow, a centrifuge is used in the laboratory. Which safety practice is important? Option A, place only one tube at any weight in the rotor. Option B, open the lid while it is spinning. Option C, balance tubes before starting the centrifuge. Option D, stop the rotor with a hand. The correct answer is option C, balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Unbalanced loads can damage the machine or specimens. Opening a spinning centrifuge is unsafe. Stopping a rotor manually is dangerous. Question 51. After reviewing the situation in a specialty referral visit, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A, air in the lungs. Option B, blood in the urine. Option C, protein in the stool. Option D, sugar in the blood. The correct answer is option B, blood in the urine. Hematuria means blood is present in the urine. Air in the lungs is not described by hematuria. Protein in stool is not hematuria. Sugar in the blood is described by glycemia terms. Question 52. For a patient encounter in a patient intake station, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A, directly into a vein. Option B, deep into the deltoid muscle only. Option C, into an area that is bruised and inflamed. Option D, abdomen with adequate subcutaneous tissue. The correct answer is option D, abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. Intravenous administration is a different route and is outside a subcutaneous injection. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Bruised or inflamed tissue should generally be avoided. Question 53. To protect safety in an infection control audit, a claim requires the code for an office visit procedure or service. Which code set is used? Option A, zip code. Option B, VICD 10 cm. Option C, policy number. Option D, CPT. The correct answer is option D, CPT. CPT codes describe medical procedures and professional services. A zip code identifies location and is not a procedure code. ICD-10-CM codes describe diagnoses and reasons for services. A policy number identifies insurance coverage and does not describe the service. Question 54. The care team in a walk-in clinic asks for guidance because a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A, allow the alcohol to dry completely. Option B, touch the vein again with an ungloved finger. Option C, draw blood while alcohol is still wet. Option D, blow on the site to speed drying. The correct answer is option A, allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Palpating after cleaning can contaminate the site unless proper technique is used. Wet alcohol can sting and may affect specimen quality. Blowing can contaminate the cleansed site. Question 55. Following office protocol in a patient intake station, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, perform blind finger sweeps immediately. Option B, leave the patient alone until they stop coughing. Option C, give the patient food to push it down. Option D, encourage coughing and monitor closely. The correct answer is option D, encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Blind finger sweeps can push the object deeper and are not appropriate. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Question 56. Before the visit continues in a busy front office, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A, tell the patient it is probably anxiety. Option B, notify the provider immediately and follow emergency protocol. Option C, ask the patient to drive to another clinic. Option D, complete all paperwork before telling anyone. The correct answer is option B, notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Medical assistants should not diagnose the cause of chest pressure. Potential cardiac symptoms should be handled through established emergency procedures. Administrative tasks should not delay reporting possible cardiac symptoms. Question 57. To protect safety in a primary care office, a patient makes a complaint about care received in the office. Which response is most professional? Option A, post the complaint online for staff opinions. Option B, listen respectfully and follow the office complaint process. Option C, argue until the patient stops complaining. Option D, delete documentation related to the complaint. The correct answer is option B, listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Publicly sharing patient concerns can violate confidentiality. Arguing escalates conflict and is unprofessional. Destroying or altering records is unethical and may be illegal. Question 58. To protect safety in an infection control audit, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A, write only the highest number ever measured. Option B, skip technique instructions because home cuffs are automatic. Option C, use another person's readings if the cuff is shared. Option D, record readings with date, time, and relevant notes as directed. The correct answer is option D, record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Selective recording can mislead clinical decisions. Proper positioning and technique still matter with automatic cuffs. Readings must belong to the patient. Question 59. Following office protocol in a community health clinic, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A, the assistant's guess about the diagnosis. Option B, only the caller's first name. Option C, a promise that medication will be prescribed. Option D, caller identity, contact information, reason for call, and urgency. The correct answer is option D, caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. Diagnosis should not be guessed in a phone message. A first name alone may not identify the patient or issue. Medication decisions belong to the provider. Question 60. For a patient encounter in an infection control audit, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. No documentation is needed for symptoms. Option B. Patient states, I have had a cough for 3 days. Option C. The assistant diagnoses pneumonia. Option D. Patient is definitely exaggerating the cough. The correct answer is option B. Patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Symptoms are relevant to the visit and should be documented according to policy. Diagnosis belongs to the provider. Judgmental wording is inappropriate and not objective. Question 61. The care team in a family practice clinic asks for guidance because a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A. Emancipation. Option B. Coordination of benefits. Option C. Defamation. Option D. Battery. The correct answer is option D. Battery. Battery can involve intentional touching or treatment without consent. Emancipation relates to a minor's legal independence. Coordination of benefits is an insurance concept. Defamation involves false statements that harm reputation. Question 62. Following office protocol in a patient education session, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A. Send the patient home to rest without notifying anyone. Option B. Recheck using proper technique and report the finding according to protocol. Option C. Erase the value because it may worry the patient. Option D. Tell the patient that hypertension has been diagnosed. The correct answer is option B. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Abnormal readings require appropriate follow-up rather than dismissal. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Question 63. At the start of care in an infection control audit, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, IM. Option B, 4. Option C, subcut. Option D, PA. The correct answer is option D, PA. PA means by mouth and is used for oral administration. IM means intramuscular and refers to injection into muscle. 4 means intravenous and refers to administration into a vein. Subcut means subcutaneous and refers to injection into tissue under the skin. Question 64. During an infection control audit, a patient requests an appointment reminder by text message. Which consideration is important? Option A, ignore all reminder preferences. Option B, post the reminder on social media. Option C, text any diagnosis to any phone number in the chart. Option D, follow office policy and patient communication preferences. The correct answer is option D, follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Preferences help guide appropriate communication. Public posting would expose private information. Sensitive information and wrong numbers can create privacy risk. Question 65. When a patient encounter unfolds in an urgent care office, blood spills on an exam room floor. Which response follows standard safety practice? Option A, use appropriate personal protective equipment and an approved disinfectant. Option B, cover the spill with an exam table paper. Option C, wipe the spill with a dry paper towel only. Option D, ask a patient to avoid stepping on it. The correct answer is option A, use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Covering a spill does not remove or disinfect the hazard. Dry wiping can spread contamination and does not disinfect the surface. Patients should not be involved in hazardous cleanup. Question 66. To protect safety in a patient intake station, the term gastroenterology appears in a referral. Which specialty is involved? Option A, urinary bladder only. Option B, digestive system. Option C, endocrine glands. Option D, a nervous system. The correct answer is option B, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Urology focuses on the urinary tract and male reproductive system. Endocrinology focuses on hormone-producing glands. Neurology focuses on the nervous system. Question 67. An office review in a clinical skills review shows that a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A, open the chart if the coworker promises not to tell anyone. Option B, share the chart because staff work in the same clinic. Option C, deny the request because there is no job-related need to know. Option D, print the chart and remove the patient's name only. The correct answer is option C, deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. De-identified information must meet specific standards and curiosity is not permitted access. Question 68. During an electronic health record review, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, ignore the waveform and record the lowest value. Option B, increase oxygen without reporting the finding. Option C, warm the finger or choose a better perfused site. Option D, place the probe over wet nail polish. The correct answer is option C, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. An unstable signal should be corrected before documenting the value. Medication or oxygen changes should follow provider direction and clinical protocol. Moisture and polish can interfere with sensor performance. Question 69. To protect safety in an internal medicine office, a complete blood count is ordered. Which tube is most commonly used? Option A, lavender tube with EDTA. Option B, gray tube with fluoride oxalate. Option C, red tube with no anticoagulant. Option D, light blue tube with sodium citrate. The correct answer is option A, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Gray tubes are used for tests such as glucose or lactate depending on protocol. A red tube allows clotting and is not the standard choice for a complete blood count. Sodium citrate is used mainly for coagulation studies. Question 70. To protect safety in an outpatient laboratory, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A, replace all state laws. Option B, guarantee every claim is paid. Option C, provide standardized guidance for office tasks. Option D, eliminate the need for training. The correct answer is option C, provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Office policy cannot override applicable law. Policies do not guarantee pay or reimbursement. Policies support but do not replace staff training. Question 71. While working in a phlebotomy station, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, correct limb lead placement. Option B, poor electrode contact or patient movement. Option C, a properly grounded machine with still patient. Option D, a normal calibration mark only. The correct answer is option B, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Correct placement should reduce rather than create artifact. Good grounding and stillness reduce electrical or motion artifact. Calibration marks do not explain baseline movement during tracing. Question 72. Before the visit continues in a clinical skills review, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A, every morning. Option B, immediately. Option C, by mouth. Option D, as needed. The correct answer is option D, as needed. PRN means the medication is taken as needed according to the order. Every morning is commonly abbreviated differently and is not PRN. Immediately is STAT in common medical usage. By mouth is PA. Question 73. To protect safety in a treatment room, A capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The center of the thumb pad. Option B. The tip of the index finger. Option C. The little finger near the bone. Option D. The side of the middle or ring finger pad. The correct answer is option D. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The thumb is often calloused and has a pulse, making it less preferred. The index finger is commonly used for touch and may be more sensitive or calloused. The little finger has less tissue over bone and is usually avoided. Question 74. The care team in a cardiology practice asks for guidance because a patient says they cannot afford a prescribed medication. Which response is best? Option A. Suggest sharing medication with a friend. Option B. Tell the patient to stop all medications. Option C. Ignore the comment because finances are private. Option D. Notify the provider or appropriate staff so alternatives can be discussed. The correct answer is option D. Notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Sharing prescriptions is unsafe and inappropriate. Stopping medication without provider guidance can be unsafe. The concern directly affects care and should be addressed respectfully. Question 75. An office review in a procedure setup shows that a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A. Random sample from an old urinal. Option B. First drops of urine into an unclean container. Option C. Specimen collected from the toilet bowl. Option D. Clean catch midstream specimen. The correct answer is option D. Clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Old specimens may be contaminated and may not reflect current results. Initial urine can carry contaminants and an unclean container is inappropriate. Toilet water contaminates the specimen. Question 76. At the start of care in an infection control audit, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A. Use the instruments if the package is dry. Option B. Open the package and rinse the instruments. Option C. Reprocess the instruments before use. Option D. Write a new date on the package. The correct answer is option C. Reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. Question 77. In a patient intake station, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A. Assault. Option B. Beneficence. Option C. Coinsurance. Option D. Abandonment. The correct answer is option D. Abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Beneficence means acting for the patient's good. Coinsurance is a payment-sharing insurance term. Question 78. Before the visit continues in an urgent care office, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Ignore all provider instructions about inhalers. Option B. Eat a heavy meal immediately before every test. Option C. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option D. Wear tight clothing that restricts breathing. The correct answer is option C. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Medication instructions should follow the provider or testing protocol. A heavy meal may interfere with comfortable breathing for some tests. Restrictive clothing can interfere with respiratory effort. Question 79. To protect safety in a medical office workflow, a provider orders spirometry in the office. Which patient action is required? Option A. Follow instructions for a strong, complete breathing maneuver. Option B. Talk continuously during the maneuver. Option C. Hold both nostrils and refuse to exhale. Option D. Remove the mouthpiece before starting. The correct answer is option A. follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. Talking interferes with airflow measurement. The test depends on controlled breathing through the device. The mouthpiece is needed to measure airflow. Question 80. After reviewing the situation in a procedure setup, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A, explanation of benefits. Option B, progress note. Option C, sterilization log. Option D, advance directive. The correct answer is option A, explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. A progress note documents clinical care, not insurance payment decisions. A sterilization log tracks instrument processing, not claim payment. An advance directive communicates future care wishes, not payment information. Question 81. After reviewing the situation in a diagnostic testing area, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, tell the patient not to call if symptoms worsen. Option B, create new instructions that contradict the provider. Option C, avoid documenting that instructions were given. Option D, review the provider-approved instructions and confirm understanding. The correct answer is option D, review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Patients should know when and how to seek help for concerning symptoms. Instructions should match the provider's plan and office protocol. Patient education should be documented according to policy. Question 82. After reviewing the situation in a patient intake station, a prothrombin time test is ordered. Which tube should be selected? Option A, blood culture bottle only. Option B, gray tube. Option C, light blue tube. Option D, lavender tube. The correct answer is option C, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Blood cultures detect microorganisms and are not used for prothrombin time testing. Gray fluorite oxalate is not the standard additive for coagulation studies. Lavender EDTA is used for hematology and can interfere with coagulation testing. Question 83. A medical assistant is working in an administrative check-in area when a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A, assume all people from that culture act the same. Option B, refuse to document relevant information. Option C, ask respectful questions and avoid judgment. Option D, tell the patient the practice is foolish. The correct answer is option C, ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Stereotyping ignores individual differences. Relevant patient information should be documented according to policy. Judgmental language damages trust and may prevent disclosure. Question 84. In an electronic health record review, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fourth intercostal space at the left sternal border. Option B, fourth intercostal space at the right sternal border. Option C, left arm below the clavicle. Option D, fifth intercostal space at the left midclavicular line. The correct answer is option B, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V2. The left arm electrode is a limb lead site, not V1. That location corresponds to V4 in standard placement. Question 85. As part of exam preparation in a telephone triage workflow, a medication is labeled for otic use. Where should it be administered? Option A, eye. Option B, ear. Option C, mouth. Option D, nose. The correct answer is option B, ear. Otic medications are intended for the ear. Eye medications are ophthalmic, not otic. Oral medications are taken by mouth. Nasal medications are administered through the nose. Question 86. Before the visit continues in a preventive care visit, a staff member shares an electronic health record password to save time. Which risk is created? Option A, automatic insurance approval. Option B, loss of accountability for chart access. Option C, better sterilization monitoring. Option D, improved privacy protection. The correct answer is option B, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Passwords do not control payer authorization. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Question 87. Given the workflow in a pediatric clinic, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A, against. Option B, before. Option C, above normal. Option D, below normal or deficient. The correct answer is option D, below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Against is indicated by anti. Before is indicated by pre. Above normal is indicated by hyper. Question 88. After reviewing the situation in a patient intake station, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, estrogen. Option B, insulin. Option C, melatonin. Option D, thyroxine. The correct answer is option B, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Melatonin is associated with sleep-wake cycles. Thyroxine is a thyroid hormone involved in metabolism. Question 89. A medical assistant is working in a medication administration visit when a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A, ask a family member to confirm the name only. Option B, use the room number because it is faster. Option C, ask the patient to state 2 identifiers and compare them with the order. Option D, label the tube after returning to the lab. The correct answer is option C. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A family member may be mistaken and 1 identifier is not enough for positive identification. A room number can change and is not considered a reliable patient identifier. Delayed labeling increases the risk of specimen mix-ups and rejected samples. Question 90. When a patient encounter unfolds in a treatment room, an electronic record uses an audit trail. What is its purpose? Option A, measure blood pressure. Option B, approve insurance claims instantly. Option C, sterilize instruments automatically. Option D, track who accessed or changed information. The correct answer is option D. Track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Payer claims processing is separate from record audit logs. Audit trails do not process instruments. Question 91. When a patient encounter unfolds in a treatment room, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, have the patient walk quickly before the measurement. Option B, measure only oxygen saturation while the patient is seated. Option C, record the first seated blood pressure as orthostatic. Option D, measure blood pressure and pulse in different positions according to protocol. The correct answer is option D, measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. Exertion can distort the readings and increase fall risk. Oxygen saturation does not assess the blood pressure and pulse changes requested. A single seated reading does not show positional change. Question 92. Given the workflow in a diagnostic testing area, a patient signs permission after the provider explains a procedure's risks, benefits, and alternatives. Which concept is demonstrated? Option A, abandonment. Option B, battery. Option C, informed consent. Option D, implied consent. The correct answer is option C, informed consent. Informed consent occurs when a patient agrees after receiving enough information to make a voluntary decision. Abandonment involves ending care without appropriate notice. Battery involves unauthorized touching or treatment. Implied consent is inferred from actions such as extending an arm for a blood draw. Question 93. Following office protocol in a women's health clinic, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A, alcohol sanitizer is always illegal in clinics. Option B, soap and water help remove spores more effectively from the hands. Option C, hand washing is needed only before eating. Option D, gloves completely replace hand hygiene. The correct answer is option B. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Alcohol-based hand rubs are appropriate for many routine situations. Hand hygiene is required at multiple points in patient care. Gloves reduce exposure but do not replace hand hygiene after removal. Question 94. Given the workflow in a cardiology practice, a reagent bottle is past its expiration date. Which action is appropriate? Option A. Do not use it for patient testing. Option B. Change the expiration date on the label. Option C. Use it only for abnormal patients. Option D. Mix it with a new reagent to strengthen it. The correct answer is option A. Do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Altering dates is unsafe and unethical. Expired reagents are not reliable for any patient testing. Mixing reagents without approval can invalidate testing. Question 95. A medical assistant is working in a walk-in clinic when a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Pack the nose with contaminated gauze. Option B. Tilt the head far backward. Option C. Lie flat immediately without assessment. Option D. Sit upright and lean slightly forward. The correct answer is option D. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Contaminated materials should not be inserted into the nose. Tilting backward can cause blood to drain into the throat. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 96. For a patient encounter in a procedure setup, a patient feels faint during a blood draw. Which response should occur first? Option A. Leave the patient alone to find paperwork. Option B. Tell the patient to stand up quickly. Option C. Stop the procedure and protect the patient from injury. Option D. Finish filling the tube before responding. The correct answer is option C. Stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. A faint patient should not be left unattended. Standing can worsen faintness and lead to a fall. Continuing the draw can worsen the situation and increase injury risk. Question 97. As part of exam preparation in a women's health clinic, a pelvic examination is scheduled. Which patient position is commonly used? Option A. Sims. Option B. Trendelenburg. Option C. Prone. Option D. Lithotomy. The correct answer is option D. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Sims position is often used for rectal procedures or enemas. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Prone means lying face down and is not the common pelvic exam position. Question 98. Following office protocol in a community health clinic, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Use the appointment time as the identifier. Option B. Stop and resolve the discrepancy before proceeding with care. Option C. Correct the date of birth without asking anyone. Option D. Continue if the last name matches. The correct answer is option B. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Appointment times are scheduling data and are not approved identifiers. Changing demographic data without verification may create a documentation error. A last name alone does not rule out an identity error. Question 99. Following office protocol in a diagnostic testing area, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A. Gray fluoride tube for all serum tests. Option B. A red or gold serum tube. Option C. Lavender EDTA tube for serum. Option D. Light blue citrate tube for serum. The correct answer is option B. Red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. Gray tubes are not the standard serum tube for routine chemistry panels. EDTA prevents clotting and produces whole blood or plasma, not serum. Citrate anticoagulant is used for coagulation testing. Question 100. While working in an electronic health record review, a subpoena for medical records arrives at the office. Which response is best? Option A. Immediately fax the entire chart without review. Option B. Ask the receptionist to summarize the chart from memory. Option C. Give it to the provider or designated privacy officer for proper handling. Option D. Ignore it because subpoenas never apply to clinics. The correct answer is option C. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Records should not be released without verifying legal requirements and scope. Summaries from memory are unreliable and not an appropriate legal response. Subpoenas can require action and should not be ignored.